are categorized based on several criteria, such as the mechanism of injury, severity, the structures affected, and the clinical presentation. Below is a detailed classification based on mechanism of injury. A. Closed head injury. The skull remains intact and there is no penetration of the dura mater. Common in motor vehicle accidents, falls, or sports injuries. Includes concussion, contusion, and intracranial hematomas. B. Open penetrating head injury. The skull is fractured or penetrated, often with breach of the dura mater, caused by sharp objects, gunshot wounds, or shrapnel. Risk of infection and secondary complications is high. Number 2. Based on severity, Glasgow Coma Scale. The Glasgow Coma Scale, GCS, is used to assess consciousness. Mild, GCS score of 13-15, includes concussion with transient symptoms like confusion or headache. Moderate, GCS score of 9-12, may involve loss of consciousness and some neurological deficits. Severe, GCS score of 8 or less, indicates significant brain injury, often with a high risk of long-term disability or death. Number 3, based on anatomical structures affected. A. Scalp injuries, lacerations, contusions, or abrasions to the scalp can lead to significant blood loss due to scalp vascularity. B. Skull fractures. Linear fracture, a simple break without displacement. Depressed fracture, skull fragments are pushed inward, potentially damaging the brain. Basilar fracture occurs at the base of the skull and may involve cerebrospinal fluid CSF leakage, raccoon eyes, or battle sign. Brain injuries. I. Focal brain injuries. Localized damage such as contusion, bruising of brain tissue. Intracranial hematomas, epidural hematoma, blood between the skull and dura mater, subdural hematoma, blood between the dura and arachnoid mater. Intracerebral hematoma, blood within the brain parenchyma. Diffuse brain injuries, widespread damage such as concussion, temporary disruption of brain function. Diffuse axonal injury, DAY, shearing of axons caused by rapid acceleration deceleration forces. 4. Based on clinical presentation. A. Primary injury occurs at the moment of impact. Includes contusion, laceration, skull fracture, or hematomas. B. Secondary injury develops over time due to complications such as cerebral edema, increased intracranial pressure ICP, hypoxia or ischemia, infection, and open injuries. Number 5, based on timing. A. Acute. Symptoms appear immediately after the injury. Examples: epidural hematoma, severe concussions. B. Chronic. Symptoms develop days or weeks later. Examples: chronic subdural hematoma. Number 6, special classifications. Hepatocategory A, pediatric head injuries. Unique due to the pliability of the pediatric skull and open sutures, often associated with diffuse swelling rather than focal lesions. B. Elderly head injuries. Higher risk of chronic subdural hematoma due to brain atrophy and anticoagulant use. Understanding the classification helps in diagnosing, managing, and predicting outcomes for head injuries effectively.